Do arterial blood gases, or ABGs, make your head spin? You're not alone. A lot of nursing students freeze up when they see a question loaded with numbers like pH, PaCO₂, and bicarbonate. But here's the thing, ABGs don't have to be that complicated. I'm going to walk you through a simple, step-by-step approach that will help you interpret ABGs with confidence, whether you're in nursing school, in clinical practice, or sitting down for the NCLEX. Hi everyone, welcome to Clever Concepts Academy, where we break down difficult nursing concepts so you can succeed in nursing school and crush the NCLEX. If that sounds helpful, make sure you like and subscribe, and let's get into it. So first, what exactly is an ABG? An ABG is an arterial blood gas. It's a blood test that helps us evaluate three things: acid-base balance, oxygenation, and ventilation. ABGs give us important information about how well the lungs and kidneys are working together to keep the body in balance. An ABG is basically a snapshot of what's happening with a patient's breathing and metabolism right now. There are 4 values you absolutely need to know. First is pH. Normal range is 7.35 to 7.45. The pH tells you whether the blood is acidic or alkaline. Second is the PaCO₂. Normal range is 35 to 45 millimeters of mercury. This one reflects respiratory function. Remember, PaCO₂ is the partial pressure of carbon dioxide in the arterial blood, and carbon dioxide is controlled by the lungs. Third, bicarbonate. Normal range is 22 to 26 MEQs per liter. This reflects metabolic function, and bicarbonate is controlled by the kidneys. Fourth is PaO₂. Normal range is 80 to 100 millimeters of mercury. This tells us the partial pressure of oxygen in the arterial blood. Here's a quick memory tip before we move on. Lungs control carbon dioxide. Kidneys control bicarbonate. If you remember just that, you're already halfway there. Now let's walk through the steps. Step 1, look at the pH. The first question you always ask is this patient acidic or alkaline? If the pH is less than 7.35, that's acidosis. If the pH is greater than 7.45, that's alkalosis. Let's practice. The pH equals 7.30. Acidic or alkaline? Acidic, correct. Step 2, look at the PaCO₂. Normal is 35 to 45. Here's the key thing to remember. PaCO₂ acts like an acid. So a high PaCO₂ means more acid in the blood. A low PaCO₂ means more alkaline. And here's the memory trick. PaCO₂ moves opposite to the pH. A high PaCO₂ equals respiratory acidosis. Low PaCO₂ equals respiratory alkalosis. Step 3, look at the bicarbonate. Normal is 22 to 26. Bicarbonate acts like a base, the opposite of an acid. So low bicarbonate points to metabolic acidosis. High bicarbonate points to metabolic alkalosis. And here's where it's different from the PaCO₂. Bicarbonate moves in the same direction as the pH. when the underlying problem is metabolic. So let's lock that in with one final memory trick. Bicarbonate behaves the same as the pH if the underlying problem is a metabolic problem. PaCO₂ behaves opposite to the pH if the underlying problem is a respiratory problem. That one distinction will save you on so many NCLEX questions. Let's pull it all together and walk through a few examples. Example number 1, pH is 7.30, PaCO₂ is 55, bicarbonate equals 24. Step 1, pH low equals acidosis. Step 2, PaCO₂ high equals acidosis. The respiratory system matches, so the diagnosis is respiratory acidosis. Example number 2, pH equals 7.50, PaCO₂ is 30, bicarb is 24. Step 1, pH equals alkalosis. Step 2, PaCO₂ is low, it equals alkalosis. Diagnosis, respiratory alkalosis. Example number 3, pH equals 7.28, PaCO₂ equals 40, bicarb equals 18. Step 1, the pH is low, that equals acidosis. Step 2, the bicarbonate is also low, that equals acidosis. The diagnosis, metabolic acidosis. Example 4, pH is equal 7.48, PaCO₂ is equal 40, bicarbonate is equal 30. Step 1, pH is high, that equals alkalosis. Step 2, bicarbonate is high, that equals alkalosis. Diagnosis, a metabolic alkalosis. Let's connect this to clinical practice. In respiratory acidosis, common causes are COPD, respiratory depression, drug overdose, and airway obstruction. Think the patient is retaining carbon dioxide. In respiratory alkalosis, common causes are anxiety, panic attacks, hyperventilation, and early sepsis. Think the patient is blowing off too much carbon dioxide. In metabolic acidosis, common causes are diabetic ketoacidosis, renal failure, severe diarrhea, and shock. In metabolic alkalosis, common causes are vomiting, nasogastric suctioning, excess antacid use, and diuretic therapy. Now let's briefly discuss compensation. The body tries to restore acid-base balance. If lungs cause the problem, the kidneys attempt to compensate. If the kidneys cause the problem, the lungs attempt to compensate. For beginning nursing students, focus first on identifying acidosis versus alkalosis and respiratory versus metabolic. Master that before worrying about compensation. Okay? Here's an NCLEX tip. Most nursing school and NCLEX questions can be answered correctly if you identify, number 1, the pH, number 2, the source of the problem. Don't overcomplicate it. A patient's ABG results are pH equals 7.32, PaCO₂ equals 50, bicarbonate is 24. What's the diagnosis? Step 1, pH is low, that equals acidosis. Step 2, PaCO₂ is high, that also equals acidosis. The answer is respiratory acidosis. Let's summarize. ABG interpretation becomes much easier when you follow 4 simple steps. Number 1, check the pH. Number 2, determine acidosis or alkalosis. Number 3, evaluate the CO2. Number 4, evaluate the bicarbonate. Remember, CO2 equals lungs, bicarbonate equals kidneys, and most importantly, take ABGs one step at a time. If this video helps simplify ABGs for you, please subscribe and share it with another nursing student. Thanks for watching, and I'll see you in the next video.